Welcome to Session 2, looking at building resilience in children and young people. This session is suitable for staff working in early years primary and secondary sectors. In Session 1, we explored what we meant by the term resilience and what it could look like in practice. We also looked at the benefits that resilience could bring for children and young people. In Session 2, we will look at the three key sources of resilience. We will explore some of the risks and protective factors that can impact on resilience, and we will explore some of the tools that can be used to assess and plan for children and young people in terms of their resilience. Part 3. The three key sources of resilience. Now that we've explored what resilience is, how it may look, and the benefits it can bring for children and young people, it is clear that building resilience within our young people is a worthwhile and beneficial endeavour that will help them to develop both socially and academically. A useful approach to use when planning how to develop resilience within children and young people is to use the three sources of resiliency framework from the International Resilience Project. This framework identifies three main sources that can contribute to how resilient someone is. These are: firstly, I have. These are the social and interpersonal supports that a person has. In other words, who and what they have. Secondly, I am. This involves the way that a person views themselves, who they are. And finally, I can. This is the skills and abilities that a person possesses. It's what they can do. Let's now take a look at the first source of resilience, which is I have. This includes the people and supports that a child or young person has in their life that help them to develop and flourish. These include trusting and loving relationships with family, friends and teachers. A clear structure at home, which is predictable and includes clear rules and routines with the use of praise and encouragement. The existence of good role models such as parents and carers, other family members, school staff and peers who model good behaviour and morality. An environment where there is encouragement and opportunities to become independent and to foster a sense of autonomy. And finally, access to good quality education, health and social care. The next source of resilience is I am. This is about how a child or young person views themselves. The kinds of attributes and qualities that are desirable in this source include lovable. The young person is helped to develop qualities that help them to appeal to others and to form lasting and worthwhile relationships. Loving. The young person is able to express affection to others and is sensitive to the needs of others. For example, they are able to be empathetic. Pride. The young person feels that they have the capacity for achievement and possesses strategies to overcome discouragement. Responsible. The young person accepts and is given responsibility. Their belief that they can make a difference is nurtured and reinforced. Hopeful and trustful. The young person has faith in institutions and people, such as family and school. They are optimistic for the future and are able to express faith and adhere to the moral structure of society. A good model to use when thinking about how a child or young person may view themselves, others and the wider world is the internal working model. We all have an internal working model that has developed since birth. This has been shaped by our attachment relationships and experiences, sometimes unconsciously, and guides how we behave and interact with others and the wider world. It is crucially important when working with young people who may need a lot of support to develop their I am qualities that sufficient time is taken to really understand their internal working model. Only then can the correct strategies be put in place to support them. The final source of resilience is I can. This refers to the skills and abilities that a young person possesses, what they can do. These include communication skills. The young person is helped to develop the skills to express their feelings and thoughts and be able to listen and act upon those of others. Problem solve. The young person is helped to develop the skills to manage problems and challenges. They are able to identify suitable people and are able to ask for help when required. They are also able to be persistent when faced with challenges. Managing emotions. The young person knows and understands their emotions and can recognize the emotions of others. They are able to manage and control impulsive behavior. Seek out trusting relationships. The young person is able to find peers and adults that they can trust and build relationships with, which are based on confidence and mutual trust. Understand my temperament. The young person has an insight into their personality and that of others. They are able to use this knowledge to effectively manage their emotions and their relationships with others. When we think about how resilient a particular young person is, the aim is for them to have strengths and abilities in at least two of the three sources of resilience. Generally, this will equip them to be resilient. However, if this is not the case, a young person will struggle to be resilient. For example, if a young person has good self-esteem, I am, but lacks anyone they can turn to for support, I have, and does not have the capacity to solve problems, I can, they will tend not to be resilient. We will now move on to part 4, risk and protective factors. Previously we have discussed what resilience is, the benefits resilience can bring to children and young people, and the three key sources of resilience. In an ideal world, all children and young people would have sufficient skills, abilities and beliefs to enable them to be resilient. However, unfortunately, this is not always the case. In order to assess and plan for young people to help them build resilience, it's important to have a good understanding of the risk and protective factors which exist. Here we will look at some of the common risk factors which can hamper the resilience of children and young people. The family. Risks can exist within the family. These include an absence of warm and healthy attachments between child and parent, low connectedness and poor relationships with family members, violence, abuse or neglect, and family dysfunction, where there is a lack of routines, structure and predictability for the child or young person. The individual. Risk factors which can negatively impact the resilience of the individual can include difficulties regulating emotions, engaging in risk-taking behaviour such as drug and alcohol abuse or criminal activity. It could also include psychological issues. Strong peer relationships are important in building resilience. However, children and young people can be at risk if they are lacking in friendships or have weak relationships with existing peers. Relationships with children and young people who engage in risk-taking behaviour is also a risk factor. Finally, the breakup of a significant relationship can also be a risk factor. There are several risk factors that are related to school and education. Low achievement and attainment is a risk factor. This may be the result of poor attendance and low connectedness to school. These factors themselves may be the result of further reasons, such as ill health, anxiety, or family attitudes to the value of education. Finally, when children and young people are not supported effectively through major transitions, this can also present risk. The final category of risk that we will look at is linked to the community. It is important to note that children and young people and their families who experience poverty will not necessarily be less resilient than those in other areas. However, children and young people who live in areas with a low SIMD may be exposed to higher levels of crime and lower levels of income and employment. Low connectedness to the community may also be a risk factor. This could be due to a lack of community facilities or a perceived lack of safety within the community. When we think about the risk factors that a child or young person may be subject to, we will naturally begin to think about what protective factors, interventions and strategies could be used to mitigate these risks. As such, the identification of risk factors is an important part of the planning process for children and young people. Working with partners will enhance what can be achieved in terms of building resilience in children and young people. It's clear that some of the methods of building resilience we have discussed can take place in school, while others transcend the home-school link, and others reside outside the school environment completely. This is where engaging partners is key. Having a strategy to engage parents and carers is a good way to bridge the home-school link. It may be a challenge to engage some parents and carers in terms of them attending the school building due to their own negative experiences of education. This is where your home-link worker can play a key role. Engaging partner agencies to support children and young people and families to mitigate risk factors can also be effective. In Inverclyde, these may include, although are not limited to, Barnardo's, Community Learning and Development, and Inverclyde Carers Centre. Signposting to organisations, activities or supports in the community is also an effective way to mitigate risk. For example, signposting parents and carers to organisations that can provide advice with finance, to food banks, or to supports for mental health. Another example could be signposting a young person who's beginning to engage in risk-taking behaviour towards a youth group or club. Many schools will have strong existing relationships with partners and resources in the wider community. Having regular discussions with other schools, perhaps at cluster level, may be a good way of sharing good practice. In Part 5, we will now look at tools that can be used to assess risk and plan strategies and interventions for children and young people. We will now look at the My World Triangle. The My World Triangle is used to think about the whole world of a child or young person. It is particularly helpful to use the My World Triangle to gather more information from other sources, some of it possibly specialist, to identify the strengths or well-being concerns in a child or young person's world. This may include information about health or learning, offending behaviour, or information about issues affecting parenting. For each side of the My World Triangle, there is an expanded resource to assist with gathering information about the child or young person. These resources can be accessed using the link on the screen. For example, under How I Grow and Develop, both named person or lead professional and the child or young person are offered prompts and statements designed to encourage them to examine their learning and development and family life. The My World Triangle supports practice that considers the child or young person's needs and risks, as well as the positive features in their lives. Strengths and well-being concerns are given equal consideration and can be structured around the triangle. Information gathered should be proportionate and relevant to the issues in hand. In many cases, it will not be necessary to explore every area of the triangle in detail, but only to look at those that are immediately relevant. However, it is still important to keep the child or young person's whole world in mind and provide immediate help where necessary while continuing to assess. Using the My World Triangle allows practitioners to consider systematically how the child or young person is growing and developing, what the child or young person needs from the people who look after him or her, and finally, the impact of the child or young person's wider world of family, friends and community. Once information has been gathered for the child or young person, the Resilience Vulnerability Matrix may be used to plot where the child currently is. The desired aim for each child or young person is to get them as close to the top right quadrant as possible. This is highlighted on the screen by the yellow box. Using the matrix is a useful way to chart the strengths and supports a child has, as well as what is still required to be done to build resilience further. If you wish to further develop your knowledge and skills in building resilience in children and young people, the resources listed on the screen will provide a useful starting point. Thank you for taking the time to watch part 2 of this training session.